employers are very acutely aware that there are affordability concerns for employees and patients, in addition to them as the plan sponsor. And so the top way most employers are going to try and get at affordability is by steering towards quality.
Healthcare in America isn't just complex, it's chaos, with the information and power stacked against employers and patients. On Margin of Care, we set out to rebalance that scale. On this episode of the podcast, we're joined by Kelsay. She is the president and CEO of the Business Group on Health and is one of the most important voices in healthcare. BGH works with the biggest employers in the world, helping its members provide healthcare benefits to more than 60 million people in 200 countries across the globe. That's a whole lot of lives. They just put out their annual employer healthcare strategy survey, which is showing, brace yourself, an 8% increase in healthcare costs in 2025. Luckily, Ellen joined us today to help break down why that number keeps climbing, what it means for benefits leaders, and what we can do in 2026 and beyond to break the trend. Healthcare costs are expected to rise to the highest rate in a decade. And it looks like a lot of that is really driven by, more and more interest in these GLP-1 medications, really a lot of other things that are sort of pushing up pharmacy costs right now. Just curious, what was the one thing that maybe surprised you most about the survey data?
Yeah, we've done this survey now for many, many years, and we've steadily seen high healthcare trend numbers. But the 8% was the highest we've ever seen. What was surprising in that number were a couple things. When you look at that trend increase over the past decade, it's a 54% compounded increase in trend. So while, certainly 8% is in and of itself significant, when you look at that over a compounded basis over a decade, it's 54%.
Yeah.
So that was, quite startling when you look back over that time horizon. Pharmacy-related cost increased quite significantly over the past 2-year period. So we, as you've said, are seeing that the pharmacy-related costs really becoming the primary driver of healthcare trend overall. Another thing I would point out in that survey is that we've always been talking about the top drivers of healthcare costs related to certain conditions: cancer, MSK, cardiovascular disease, diabetes. What was interesting to see was that mental health related costs were the top 5 driver of healthcare trend and spending for employers as well. We've known that obviously there's been a huge focus on mental health in recent years, addressing access and stigma related challenges. We had not seen mental health come into the foray as one of the top drivers of cost. So on the one hand, that's a good thing. People are getting services that perhaps they hadn't been getting before, but we are now seeing that it becomes a cost driver in addition to the other things we've already discussed.
I was thinking back to years ago when I was an analyst too on the consulting side. And I remember being in front of clients and talking about cost and utilization reporting. And at the time, I think it was like something like 12% or 15% of costs were associated with pharmacy. And now I'm hearing numbers closer to 20, 25%, 30% of a client's healthcare budget now are actually attributed to pharmacy. So just in the past 10 or 15 years, like that kind of jump, it's astounding. So what are you seeing happen right now in terms of how employers are balancing sort of, access to new treatments, whether it's GLP-1s, whether it's some of these other cell and gene therapies that are amazing in terms of helping people? How are you seeing employers being able to actually balance access with the long-term sustainability in terms of like having the ability to cover those types of expenses with their balance sheet?
It's a complex challenge. There is no doubt that many of these new therapies and pharmaceuticals are unbelievably innovative. And when it comes to cell and gene therapies, they are treating conditions for whom those patient populations are in dire need of those therapies. So I don't think there's clinically a debate about the value of those drugs. It is the cost of those drugs that is really the concern. When you have more and more potential individuals covered on your plan who might be in need of those cell and gene therapies. Right now, for the most part, they're extremely rare conditions for whom, any one employer might not have any, or if they had maybe 1 or 2 people on their plan, that would probably be the extent of it. When you look at the drug pipeline for cell and gene therapies, there are increasing numbers of therapies being developed for conditions that will treat a broader swath of the population. The example I've heard of is that there's a cell and gene therapy in development for peanut allergies. Now, we don't know what the price tag for that is, but if it comes out at, what we've been seeing, there's a large percentage of the population who has a peanut allergy that might want to take that drug, might be in need of that drug. And so what is the implication for a health plan? I think a couple of things that they're doing about that, they're I think getting very smart and well informed about what is in the pipeline, working with their consultant and PBM partners to understand coverage implications, understand clinically the potential need within their covered population for those drugs. Some of them are working directly with manufacturers to negotiate better potential pricing for those therapies. And others are looking at different financing arrangements. So, we've had things like stop loss, we see things like outcomes-based pricing, different types of, financing arrangements to try and hopefully make it more tenable, at least in the near term, for employers to cover these. Overall, though, what we come back to, and it's not just unique to cell and gene therapies, it applies to GLP-1s, it applies certainly to specialty medications, is just the price at launch of some of these drugs is, quite honestly, probably not very realistic.
Right.
And, there's an opportunity to go upstream with, pricing regulations, potentially policy interventions, and market-based reforms to try and address some of the, the prices at launch with some of the manufacturers.
The employer's facing this issue where you've got hundreds of thousands of dollars of drug expense tied to, one or two members of the population, if not millions of dollars tied to one or two members of the population. So it really is about okay, we've got to cover these. What can we do to continue to control the balance of the costs that maybe employees and their families are sharing in something like GLP-1? So are you seeing a bit more focus around cost shifting and the ways that employers can kind of share in that cost of GLP-1s as opposed to picking up such a large percentage of it?
Yeah, it's really a spectrum of reactions from employers. I've heard from some that have said exactly what you've just said. I've heard from others who've said we are going to stop covering the GLP-1s for obesity altogether. Others who have said we want to continue covering GLP-1s for the treatment of obesity, but we need to have stronger parameters and criteria in place to ensure that the absolute appropriate people are on it and that they're adhering to the interventions, lifestyle and otherwise, that need to be adhered to be on that medication. And then others are really looking at the overall plan design to say, am I pricing these appropriately? Is there cost sharing that I need to consider in a different way? I think overarching all of this, back to the trend conversation, though, is employers are very acutely aware that there are affordability concerns for employees and patients, in addition to them as the plan sponsor. And so they are reticent to pass along any additional cost share when they can avoid doing so. Now, their backs might be increasingly up against a wall where they're going to have to make some of those trade-offs and make some decisions and potentially look at that. But I think that will be, something that they will consider as a very last resort. But they're also making hard decisions in other areas, not just related to drug pricing, and looking at vendors a little bit differently to help them navigate those some challenging waters there too.
Yeah, I think it's probably around accountability of benefits advisors, accountability of vendors and service providers. Large employers are offering something like 14, 15, 16, 17 different vendors within their benefits ecosystem. And it's creating a lot of complexity. And yet we're still having this conversation about trends being where it's at. So ultimately, at the end of the day, are all these different things that are being thrown out the wall driving the type of ROI that employers are going to need to see?
Yeah, the vendor accountability theme has been something we've been watching closely for the past couple of years. We, annually put out a trends to watch, and it was something we flagged 2 years ago. We double scored, underlined it in our trends to watch this year. We see it coming through loud and clear in our survey data of this need to be, hyper discerning in both whom they're selecting as their partners, how they're assessing performance of those partners, what data they're getting to, validate the outcomes that the partner is purporting to be achieving, and also holding themselves accountable. Many employers have their own internal dashboards that finance is looking for about, how they've partnered and is this, the performance of those vendors working, and is the HR team and benefits team achieving their internal objectives. And when they're thinking about, the partnership objective of this, I always do say partners. It is vendor accountability, but they are increasingly looking at vendors who are going to have a partnership orientation to a long-term collaboration with that employer and their plan members. And so things like, how are they, the vendor, engaging with plan participants, not just engaging to get them to enroll, but engaging to actually partake and participate and hopefully benefit from that offering. And how is that vendor partner collaborating with other vendors that employer is working with? So are they sharing data? Are they doing warm transfers and clinical referrals? Those are all things that employers are now increasingly asking of their partners. We're also seeing that employers, while it's very hard to do, they will unwind a vendor that is not, delivering.
Performing, yeah.
Yeah. And so that, I think that's something that they had been reluctant to do because there's noise, there are employees, disruption when you do that. It takes a long time to select and implement, and then to unwind it is, equally challenging. But they're increasingly willing to do that if the vendor is not performing.
What are you seeing in terms of trends or innovations that you all are most excited about that employers are thinking about adopting or starting to adopt right now?
This is the year of the RFP. It seems like just about every single employer is out to bid for at least one, if not more than one, line of service or vendor performance contract. So lots of anticipated movement and a lot of interest in alternative models, alternative health plans, alternative PBMs. Interesting trend to see, how much business might move in that direction, and do those vendors actually improve performance and outcomes? That will take a couple of years to see, but in employers where they have already implemented those solutions, they are seeing some notable and impressive results. We are also seeing, again, not a new trend, but a heightened focus on quality. So movement towards advanced primary care arrangements, movement towards centers of excellence, high performance networks, really looking at steerage towards quality providers for all types of services. Like I said, anything from primary care up to very, serious types of centers of excellence types of procedures. In the pharmacy space, we are seeing some continued increase in adding biosimilars as, a preferred or at least at par to other drugs on the formulary. So I think that's been an opportunity for some cost mitigation that employers had not to date fully availed themselves of, that we're seeing some increased interest in doing so in the next year to 2 years. So I would say those are just a few that I would call out, but there are a number of other interesting things to keep an eye on as well.
There's been a fair amount of consolidation here just over the last couple of weeks, quite frankly. We saw, different acquisitions that are being made to essentially, make an advocacy solutions program more robust with different quality data. And we've seen other large organizations, partner with each other. Do you think we're sort of heading to this path now where consolidation is going to become more prevalent than maybe new vendors being added to the ecosystem?
I think yes and yes. I think we will absolutely see consolidation, but we will also still see some new solutions. And I'll expand on that a little bit more. Even before the pandemic, there was a challenge with point solution fatigue and solutions not being integrated and some redundancy amongst solutions, and employers looking for some rationalization and consolidation within the vendor landscape. And then in the pandemic environment, more solutions were implemented. A lot of great new capabilities were introduced from a virtual perspective, certainly in behavioral health, but in other condition areas as well. And so you had a situation where employers were looking for consolidation, looking for integration, and then new solutions came to the market that were viable and needed in a lot of ways, but exacerbated the pre-existing challenge. And for a lot of reasons, we're, post-pandemic economic environment, this need for consolidation is driving, some of that integration across solutions and acquisitions and partnerships across solution vendors. That is a good thing. And it will bring, hopefully, efficiencies. It will bring, obviously, I think a better patient experience, the more, seamless those transitions happen, and hopefully, obviously, improve cost and outcomes as well. At the same time, though, there will be new solutions and there will be needs that these, existing solutions aren't addressing, or new emerging capabilities, whether it be technologically, AI related, new conditions. AI is the one that I've been talking about most recently, but it was also GI and digestive. We've seen, some condition areas really emerge as areas of opportunity. And there are some very valid capabilities and vendors out there that are doing a nice job of partnering with employers to address those conditions. So I think we will see both. We will see consolidation, but we will also selectively see some new entrants come to market that do meet some important needs.
What is speaking of AI, like what is your view on the influx of some of the tools tied to AI? You feel like employers are ready? Like, what observations have you made so far in conversations that you're having across sort of your member companies?
Our survey's in the field right now, so we'll see what the next survey says. But last year, there were equal parts excitement and trepidation about AI. A lot of potential, but some near-term skepticism about privacy, security, cost of the investment of AI. And so far, the use cases have been mostly on the clinical side, related to communication, benefits navigation, ease of open, communication during open enrollment, benefit, understanding your benefits and your offerings that the employer is providing to you. So I think, we're still early days on kind of the employer realm of how they might be able to deploy AI within their health and benefit plans. They're hearing a lot about it from their vendor partners. I think there is a lot of potential longer term opportunity. The skepticism that I do hear from employers is, in the near term, all these vendor partners of mine that are investing in technology and AI, is that cost of that investment going to be passed through to me as the plan sponsor? Am I going to see my rates and fees go up as the vendors themselves are having to invest in this technology? And then also, we heard earlier this week, somebody was talking about, like different vendor A and their AI agent and vendor B and their AI agent. Are those AIs going to be complementary, or are they going to come out with different recommendations for the member? And then whose AI wins, right? So do you have the battle of the AIs, and is there a way to kind of harmonize how AI is making recommendations to the plan participant? So I think just kind of understanding the integration from an AI perspective across multiple vendors, and is there a way to harmonize that? Or near term, does that create more fragmentation, more confusion, and the cost aspect of that as well?
I guess there's an argument to be made that AI as a provider, or sort of a replacement for a provider, actually could be potentially a good thing when you compare AI to like underperforming doctors who are not doing things clinically by the books and ultimately driving up costs for the plan. Like, do you think employers at this point are ready to think about like AI in the sense that it actually could replace and or complement the role of the physician right now? Have any of those conversations happened?
Yeah, I think, of course. I think there's a lot. I mean, that is, AI should augment and supplement and hopefully provide better leverage so that the physicians can spend more time doing the things that are most, applicable from a human to human interaction. A lot of what physicians spend their time on, or clinicians spend their time on, are low value administrative tasks. So if AI can do those tasks and provide more high quality interaction for the clinical team to engage and interact with the patient, I think that most employers and certainly most patients would welcome that.
One of the interesting things that we're doing with AI right now, we're not actually kind of substituting human beings with AI right now, but what we are using is actually AI technology to go out and actually grab appointment availability from doctors, because what we find is that provider directories are often pretty inaccurate. They're pretty stale. So the likelihood of somebody going out to a provider directory and actually being able to book an appointment with the first doctor or two that they call is pretty low. But I think one of the cool ways that we're using AI right now is actually going out and grabbing that appointment availability to ensure that if we're going to surface a doctor that we think is high performing, that the member actually can access that doctor when they need care too. Because I think accessibility of care tends to be still a problem that employees have as they need to go out and seek care for themselves or for one of their family members as well.
And I also, what I loved about that example was how you're partnering with other vendor partners, right, to bring some of that to life. So yeah, I think that's a great example.
Let's talk about maybe one more thing that you brought up, affordability, as we were talking about just medication costs a little while ago. So as you think about employers continuing to report concerns around affordability and the fact that, a lot of employer-sponsored healthcare coverage is still leaving people functionally uninsured because the lack of liquid assets that they've got on hand and like the high deductibles that plans have today or the high out-of-pocket maximum that plans have today. What creative strategies are you seeing right now that are helping to kind of contain costs without cutting value to the members at the same time?
We did another survey that we just released in May, and it was our wellbeing strategy survey. And we were very heartened to see that employers are maintaining, if not expanding, their investments in wellbeing programs. And we, quite honestly, weren't certain what the feedback to that survey question would be in this economic environment with high healthcare cost trend. Would employers be needing to make some tough trade-offs and maybe de-invest in what they're doing in broad-based well-being programs? And we did not see that at all. We saw that 73% are maintaining their level of investment and another 20% are expanding and increasing their level of investment. And that speaks to the fact that, a lot of employers truly believe that investments in physical health, mental health, financial well-being, social connectedness, all of those things, job satisfaction, they are vital to healthcare and overall, productivity, engagement, et cetera. And so employers are not backing down on investing in broad-based well-being with the hope that that is an investment in health and hopefully investment in addressing some of these underlying population health concerns. So that was just great to see. You mentioned financial well-being, an area of hyper focus in the coming years is around financial well-being and what more employers can do to support people financially, whether it be, through financial education, loan programs, access to earned wage programs, tuition reimbursement, depending on the industry. There are a number of things that employers consider in their financial well-being package. So very focused on that. From just a general kind of more traditional healthcare delivery system perspective, we've talked about a few of them. Driving towards quality absolutely is going to be the top way most employers are going to try and get at affordability is by steering towards quality to hopefully get to the most effective physicians, clinicians, centers, what have you, for treating the conditions that their workforce needs. That will be done appropriately, correctly, hopefully efficiently, will yield better outcomes and hopefully, improve downstream costs. The other thing, though, the big elephant in the room that we've already talked about, though, is drug pricing. Mm-hmm. And that's a bit of a runaway train right now. And so we, from a policy and advocacy side, are keeping a close eye on what the government activity might be around that space. And then certainly on the market-based side, we have a pharmacy benefit committee. We convene forums all the time where we're bringing cross-industry stakeholders together who have key roles to play in the pharmaceutical supply chain to talk about what types of reforms can be done on the market side of drug pricing as well.
What story or stories have sort of stuck with you recently as examples of like hard decisions, but leadership and action as it relates to, what your HR members are sort of having to deal with?
Oh, there are so many examples of employers who have, created well-being dashboards, and they have, they're holding every single leader of their team and every manager to well-being standards and the well-being of the people that they care for from a supervisory perspective, and tying them back to core values of the organization. And those individual managers are evaluated on that, and their compensation is tied to that. I mean, that's not just lip service. That is putting that into action and walking the walk, talking the talk. Lots of other examples more recently of employers doing things, where they've direct contracted and have really changed the primary care model in certain communities. Disney's done that in Orlando, as have many others. So many, many great examples of employers, taking some key leadership moments to support their workforce and stepping up. I increasingly hear I was just on a call earlier this week, of employers being one of the few remaining trusted institutions, and employers being increasingly looked to by public health officials to communicate public health messages because of some of the distrust in other institutions right now. So I think it'll be interesting to see the role that we at the business group play and that employers themselves play in just the broader public health arena going forward as well.
Yeah, it's funny. I just was doing a podcast with one of our former colleagues, actually, Seth Serksner. He's got a health literacy podcast, and he and I had a chance to do this a week or two ago. And as part of that topic, we were sort of getting into like, what is the role that the employer plays in improving health literacy? And we're sort of using an example right now. One of our senior employees, they've got a spouse who's actually having a baby here in a couple of weeks, and the spouse is part of social media. They're tapping into TikTok in this example, and the algorithms are targeting her as an expecting mom. So she's getting a bunch of different influencers through her feed on things that they're advertising and trying to ultimately market to expecting mothers. And there was one feed that came across that said, "Hey, you all should have your baby at a particular hospital system in New York City, because if you do that, the hospital system will gift you a free Chanel bag. So a bag that's worth $3,000, $4,000, $5,000. Have your baby there and you get a free Chanel bag." So that's how people are making decisions right now. With the scary thing about that is the data that we see on that particular health system is that facility in particular has not only the highest complication rate after delivery, it also has the highest rate of unnecessary C-sections for low risk maternity, and it's got the highest negotiated costs per delivery in New York City. But that's how people are ultimately being influenced with their decisions right now. So I do think employers do play such a key role in communicating and helping these members make the right decision.
I had heard that story about the New York example and the handbags. That's outrageous. But yeah, I've heard that too. And that is how a lot of people are making decisions. They're looking at TikTok and what they're getting on social media.
We've got time for like one more question here. And this is sort of a big question. So if you could give one piece of advice to someone who was just newly appointed to the head of benefits at a Fortune 100 company, what would it be?
Oh my gosh. Be bold. And this is not for the faint of heart. So I think, being very strategic about your plan, being hyper prioritizing of all that you are taking on, forging strong partnerships internally with your finance team is vital, and being willing to push yourself and your partners to think creatively and differently, and use data. That's you asked for one. I probably threw 5 at you right there, but there's not just one thing.
It was a great answer. I'm glad the audience got a bunch.
These are really hard jobs, and major props to any benefit and HR leader these days or newly entering the field, because there's a lot to contend with, and these are increasingly challenging roles and an increasingly challenging environment to do them in.
Yeah, really well said. This was a fascinating, fun, timely conversation with you, Ellen. Thanks so much again for taking the time to do this.
Anytime. Always fun to be with you, Kirk. Thank you.
If you're liking the conversation, be sure to subscribe so you don't miss future episodes. And if you've been enjoying Margin of Care, please leave us a review on Apple, Spotify, or wherever you listen. If you've got feedback or questions or something you'd like us to cover on the show, send us a note anytime at marginofcare@getgarner.com. We'd love to hear from you.